Fred Marshall, who you see here behind me, believes he deserves benefits after being exposed to Agent Orange during the Vietnam War.
He's been dealing with Veterans Affairs, first applying, then being denied, and now having waited 9 years to get a hearing, which will finally happen March 2nd. Fred Marshall is fighting for benefits.
Fred Marshall sat this afternoon in his Northside Youngstown home, his Parkinson's disease making it hard to turn the pages of his binder.
I will give you a copy.
The Parkinson's, he says, along with hearing loss, hypertension, and heart issues, were because of his exposure to Agent Orange during the Vietnam War.
They sprayed the whole base. We used to stand there and watch them overhead spraying.
Fred Marshall spent 4 years as a crew chief in the Air Force, partly at air bases in Thailand, of which he has an album filled with pictures, some of himself. He also has a picture of what the airplanes looked like while spraying the Agent Orange.
But in 1969, they found that Agent Orange was toxic to humans.
Marshall's binder is thick with papers tracking his efforts to get Agent Orange benefits. He first filed with Veterans Affairs 9 years ago. 2 years later, he was denied because of what's known as the Perimeter Rule, where after 1972, Agent Orange was only allowed to be sprayed around the perimeter of an area. Marshall says, in the case of veterans who served in Thailand, except for those in security, the VA grandfathered the Perimeter Rule back to 1964.
Which is illegal, but they're doing it.
He even wrote a letter to President Donald Trump and his wife, which the VA acknowledged in a response. He thinks it was the letter to the president which got him the March 2nd hearing.
There are thousands of veterans that they have turned down because of this Perimeter Rule. I would like to get this overturned for the benefit of all the veterans that have been denied.
Fred Marshall says government doctors in Cleveland 7 years ago decided his health issues were caused by his exposure to Agent Orange. He claims the VA owes him $250,000 in back benefits and then should pay him $2,000 a month along with free health care.